one question that we have is, do you offer any medical marijuana to people with migraine headaches?
So I don't think it's actual medical marijuana.
It's not approved for migraine headaches yet, but have you given, would you recommend medical marijuana for somebody who has like a neurological issue?
Yeah. So medical marijuana, I'm actually very open to that premise. I do prescribe it too. And I look at all the medicines we use in modern day, and to me, if you look at medical marijuana and you look at other medicines, I feel like, to be honest with you, from my perspective, something comes from the ground. It's actually more natural. Some of the synthetic compounds we use, that's understanding someone's maturity level, their prior experiences, and what their medical condition is. But if you take those factors into play, medical marijuana has there are definitive conditions that it would work for. Chronic pain, huge fan. There's a huge opioid crisis going on in this world. People on fentanyl. When I was in New Mexico, I was talking to the driver, my Uber driver, and he was saying, fentanyl is such a big deal out there.
Wow.
And in local communities, you still don't know about it, but opioids are such a big deal. And it does not have the same, some people can have an argument that it's a gateway drug, but I'd love to have that debate. But the premise here is that you don't want to put someone on chronic opioids for chronic pain. That's a big deal. Now, I know if there's other physicians listening, they say, hey, look, there may be a role, and you're right, there may be a role. I'm not saying never.
For maybe good. 2 days after a surgery.
It's never. I don't want to I don't want to take away from the premise that there's always a place for something. But just the same way, there is always a place for something. So whether it be marijuana, yes, or maybe an opioid for a slim case. But I do believe it. It's not officially approved for migraines, but the truth is, in the right clinical setting, chronic pain may qualify for chronic migraines. So you could use it. So I would, if patients feel like it helps, help the patient. That's it. It comes out. Marijuana is still in that phase where federally it's not approved, but state-wise it's approved. Correct. But even state-wise it is approved by certain insurance, by certain reasons. And right now, I don't know if I can bunch medical migraine into chronic pain. Can I? I think the neurologist can
put to do it.
So they can do this. This is not trying to. I think depending on your specialty, it may be a little easier.
Okay.
But for a doctor to prescribe medical marijuana, first of all, we can give a certification. It's hard. If there's technicalities, we can't really prescribe it. The interesting part about medical marijuana is the doctor will certify you based upon your prior history, your toxicology screen, your indications. He'll put in a request. The state will approve that request.
I see.
Then you will go to the pharmacist,
and they will
actually dispense it based upon their recommendation. So it's actually the pharmacist in this state, kind of crazy affairs, who will decide kind of what your THC to CBD ratio would be. And again, people know the THC is the thing that potentially can get you a little high. The CBD has therapeutic qualities too. Depending on your condition, you have to balance those ratios. And sometimes I talk to my clients who I've given the license to, and this is a great topic that we will talk later a lot more about. One other, so this is going to be a segue into our next couple of questions that I was looking to ask you, and that is do you think that have you ever tried psychedelics? Any psychedelics? And if you have ever have you ever tried, as a neurologist, have you ever tried any mind-bending drugs or consciousness-enhancing drugs? Wow, what a question.
Like LSD or psilocybin or ayahuasca or mescaline or ergot or peyote, anything.
So I will say that
you don't have to. You can always plead the fifth, but would you ever be open to?
So I've heard. So I've heard.
Yes.
I've heard.
We're going to be putting this everywhere, but please say.
But I'm fascinated by the mind. And I'm fascinated by the capacity of the mind. And I feel like as much as we know in medical science, we still don't know a lot. and maybe that's what actually got me to where I am as far as my field of fascination, right?
Yeah.
So I'm not here to promote or condone the use of anything, because at the end of the day, you're going to look at your life, you're going to figure out what you need to do. I will do the same for myself. All I know is that there's certain compounds out there that have qualities that can expand the mind. And whether, I think the hottest topics would be people who have gone to South America potentially for ayahuasca. That's one of the things, like Mexico, Central America. I've heard of ayahuasca out there. And I think the other hot one is psilocybin.
Psilocybin is mushrooms, those are magic mushrooms.
So to the point of this is, people may say this is fringe, but I want to point out to people, Johns Hopkins has a psychedelic center. This is, so it may be promoted as fringe on some level, but big internationally renowned institutions are doing research on this. And there's a reason for it. They're getting funding. So I guess at the end of the day, there's products out there that, taken with the right
guidance,
reason, guidance, direction, may have a therapeutic role. That, again, how people do that and how they go about that is a very personal decision. I'm not condoning promoting it, but I think it's fascinating.
It is a new emerging
and
field.
I just will tell you that there are doing studies even locally. NYU has a psilocybin.
NYU, Mount Sinai.
And I'll tell you, this could be have another whole discussion on this. I'm happy to talk about
that will be our next session. So I mean, I wanted to bring it into your consciousness.
They've done studies in Denmark. I'll say this: that they look at people who have been smoking and alcohol at separate studies.
It cures your addiction.
Smoking cessation.
It
higher
cures your
psilocybin.
addiction.
Alcohol reduction. PTSD. Those are the three that I.
And cancer, end of life. Transition. They say that anxiety caused at the end of life, psilocybin kind of releases you from it.
So
so that's and none of these medications are addictive. They're not non-addictive. Like, can you imagine like something like LSD or psilocybin you use once or twice in your life and it cures something? Like, one of the things that I am fascinated with is like the way modern psychiatry has failed. Like pretty much all of its patients, and how to actually pick a patient for somebody who may and I think I would go even so far, like I've studied Michael Pollan, I've been following him for like the past 10 years or so, and I just recently saw, it was in the New York Times, and recently I even saw his Netflix series, and I was like, maybe we will discuss it in our later on. But the thing is that they were even mentioning how some of these medications have altered the lives and mindsets of people who were suffering. So it can elevate your not just consciousness but also release you from suffering.
I think the word I use is healing. If something can
bring you peace,
healing, and it may not come in the direction that we always perceive it. And it could be a person that you never expected. It could be someone who randomly could be a stranger even. So I think healing comes in different. I've learned. I'm very humble to understand that healing comes in different ways. It doesn't always have to fit in the paradigm that you think. So that's why we have to kind of be open-minded to people and experiences. And I'm not sure where they come from. I think there's a universal divinity that brings things your way, whether it be this conversation or something different. But I think there's beauty in that. So I think we should end on that.
Exactly. And I one of the things is that we have a question is like, what is your Instagram handle and a website where people can reach you?
Okay, so I need to get. I will do that. I will reach out next time we have this. You'll have an Instagram
handle and you have a website.
The website
right?
we have is called regionalneurological.com. regionalneurological.com. And again, happy to have anyone's insight on that. They can reach out. They can get us to the contact form. But the Instagram, I'm going to have one based upon these conversations. It is probably overlap with you because you've been such a launching pad for me
Yes,
to get
yes.
into this